second podcast of Nurture KC News. I'm Angie Henderson, our communications director. And on our last episode, we focused on Nurture KC and its role as a nonprofit in the political world. Today, we are doing a deeper dive into Nurture KC services, specifically our flagship program, which is Healthy Start, and how it improves infant and maternal health in Kansas City. With me today are Tracy Russell, Nurture KC's executive director, Shannon Williams, our Healthy Start program director, and Marcella Metcalf, our lead community health worker here at Nurture KC. So Tracy, we'll start with you if that's okay.
Sounds good.
Tracy has led Nurture KC for more than 4 years and has more than 20 years in the political advocacy arena for nonprofit organizations. So love your experience there, Tracy. And she brings that perspective to Nurture KC, believing that direct service and participation in the policy landscape are crucial to improving the lives of the families we serve. So with that, Tracy, can you tell us a little bit about Healthy Start and how the program came to Kansas City?
Sure, I would love to. Thanks, Angie. So Healthy Start, believe it or not, has been around for more than 30 years now. It was begun in the mid-90s, and it was really the federal response to alarming infant mortality rates in the U.S., and in particular, the effect of infant death with our Black babies. So here at Nurture KC, we have had the program for over 20 years now, which is unbelievable.
It really is.
And we're just one of 101 programs across the country. We are the only urban program in Missouri right now. And we actually are somewhat unique in that we serve families in both Kansas City, Missouri, as well as Kansas City, Kansas here. So a bi-state Healthy Start. It was interesting because as this was going on at the national level, the state of Missouri was also doing its own report on infant mortality. And we found we had pretty alarming rates of infant mortality in Missouri. And as a matter of fact, the recent data puts us in the bottom quarter of states when it comes to infant mortality. So clearly there's work to be done, and we're absolutely trying to make a dent in that here in the Kansas City area.
Thanks, Tracy. What do you think really sets Healthy Start apart from other programs?
There are some key facets that really set this program apart from others, in my opinion. The first I would start with is this is very much an evidence-led model. There is this built-in accountability that you just don't necessarily see with every program that's implemented. And by that, what I'm talking about is we have benchmark goals that we are expected to meet. And I would even characterize these as stretch goals. They are quite ambitious, but the ability of the team here to meet those is unbelievable. And I know Shannon's going to talk about those in a little bit. I think the second thing is we are a community health worker-centered model. So it's really those one-on-one relationships that drive our program and build that trust between families and the community health worker for best results. Thirdly, I think is, although we're a federal program, we're very local in how we operate. We have these federal benchmarks, but yet we adapt a very local approach and tactics to accomplish them. And I love having that flexibility for the program. And then it recognizes that every community is unique and needs a different response. And then lastly, what I continue to be blown away by is the number of participants served each year. We serve 700 plus participants in our program every year, and that's with 8 community health workers. To me, that is an astounding number, and that isn't just one touch through the year. That is a monthly touch with their community health workers. And to me, having that kind of continuity is what allows us to reach those people and reach them in a way that's effective for them.
Great. Thank you so much, Tracy. That's really helpful to know and understand. So next, Shannon, we're going to turn to you. And Shannon has been at Nurture KC for almost a decade now, right? And you began as the education and health coordinator and has been the Healthy Start program director since 2020.
Correct.
Yeah, so lots of depth and breadth and experience there, which is great. Shannon is an experienced health educator and has worked to improve birth outcomes for both English and Spanish speaking families for over 15 years, which I think is really important to note. So Shannon, talk to me about the structure, kind of building on what Tracy said of Healthy Start and the services that you guys actually provide to families.
Yes, of course. Thank you. As Tracy mentioned, we have a very small staff. We're small but mighty. There are 8 community health workers. We contract with 2 federally qualified health centers. So we are have our Healthy Start program embedded at Swope Health Services and also Casey Care. We also have a community health nurse that's on staff, and so she's able to see high-risk pregnant women at all 3 locations. So for Healthy Start, we offer 3 tiers of services. So of course, there's direct services. Our families are all eligible to receive pack and play cribs, car seats. We are a Happy Bottoms location, so that means a minimum of 50 diapers per child per month that our family is able to receive. But then that next tier is education. So they're not just getting items. There's going to be safe sleep education for the pack and play. All the community health workers are trained as child passenger safety technicians. So that means teaching families to correctly install car seats as well. We do breastfeeding education. We also work with our community health nurse to offer additional education for our high-risk moms, but she also does education for the community health workers and then the community at large. That third tier is going to be referrals for additional resources. As I mentioned, we are a very small organization, so we partner with other agencies to offer additional services. So infant toddler services, job training, mental health services. We're going to look out and see what's already available in the community and make sure that our families are connected with those services. We also have a family portal on our Nurture KC website, so that houses numerous amount of resources that our families can access quickly, and it's available in English and Spanish.
Yeah, that's great. That's so important. So it can actually be a benefit to all your families.
Exactly.
Which is great. I want to ask you next about some of the benchmarks that Tracy, mentioned. Could you expand on that and talk about their scope and how they really inform the work that you guys are doing?
Yes, of course. As Tracy mentioned, we are very data driven in Healthy Start. We have an evidence-based approach, and that data shows the effectiveness of our program. Our Healthy Start has 19 benchmarks that we are required to meet over our 5-year grant cycle. And of the 19, there are 18 that we have exceeded or very close to meeting. Some of those benchmarks include medical care, so that all of our moms and our children have identified a medical home, that they are insured, that our moms are getting both prenatal care and then that postpartum visit after they deliver. We have benchmarks on children being up to date for immunizations. We also have benchmarks on breastfeeding initiation and how many moms are still breastfeeding at 6 months postpartum. We have a couple of benchmarks on fatherhood involvement, because the fathers are a huge part of Healthy Start and part of our required participants that we serve each year as well. We also have one of our favorite benchmarks is how often families are reading to our children as well. So we've been able to promote literacy as well as a way to build bond and education for our families.
That's great. I love that one. So as Healthy Start evolves to meet the needs of our families, can you talk a little bit about the innovations that have happened and how it's changed since you've been at the helm as the director of Healthy Start?
Sure. We are very proud at how adaptive Healthy Start has been able to be. And a lot of that is because of the leadership of Tracy here at Nurture KC.
Thank you.
We've been able to swiftly change at what our families needed. So a perfect example of that was COVID. Yeah. And we saw that there was a lot of food scarcity within our family. So we were able to get additional funding and make sure our families had gift cards to purchase food for their family. Since then, we've also partnered with University Health. They are doing a pilot program right now where their Healthy Harvest food market, mobile market, is offering produce twice a month to 25 of our Healthy Start families. And that produce also comes with education and recipes. And the whole idea is behavioral change to improve health, overall health for the whole family. Another addition is that the community health nurse that I mentioned. So all of our moms that identify as being medically high risk during their pregnancy, they're able to opt in to receive that extra clinical support from our community health nurse. We've also been able to provide transportation services for our Healthy Start families. So coming to Healthy Start visits, medical visits, social service visits, and then twice a month they're able to use Uber to go to the grocery store as needed as well. So that's been an excellent way at tackling a barrier that many of our families have at getting care.
Sure.
And then lastly, a huge one is that we partnered and received a grant with Health Forward Foundation, and we are able to offer free doula services to 25 of our Healthy Start moms. And not only are they getting that service, we're also training 3 community health workers to become doulas, as well as 3 Healthy Start program participants to become doulas. So not only does that increase the amount of doulas that are in the community, it also has a financial impact for those 3 women that can get some entrepreneurial skills and potentially change the family's well-being.
Yeah, sure.
Another service that we included in Healthy Start was providing virtual support groups for our moms. Our program is called Mother's Voice and Voice de la Madre in Spanish. So we have 2 groups, an English-speaking group and a Spanish-speaking group. And together they meet with their peers and they tackle all kinds of mental health issues. So they talk with a professional counselor and each other. Issues about postpartum depression, just how hard it is to raise a child, disciplining, partnering with a spouse or the father of the child that's not in the house. And so that's just been an added bonus and a way to help build community, especially after the pandemic when we got so used to being alone and not having those connections in person. And although they do meet virtually, we do twice a year have in-person events. We had one in May. Both were a very huge success. And it was great to see the moms to realize each other's strengths and that they can rely on each other.
Yeah, that community is so important. And I think Nurture KC does a great job of pivoting and meeting moms, when they need the most support. So that's amazing. Thank you so much for sharing all of that. That's really impactful information, Shannon.
Thank you, Angie.
Yeah. All right. Last but certainly not least, we are going to wrap today with Marcella, who I know our families adore, and she has that special one-on-one connection with so many of our moms, Marcella, which is so great to see. She's the lead community health worker here at Nurture KC, and she's been with the organization for 5 years. She has many years of experience working from families of all different cultures and background, and as a social worker, which I think is really important to note that, and that you were also a medical interpreter for many years, helping many families of different backgrounds as a bilingual family support specialist. So let's just start, Marcella, with what draws you to this work.
Yeah. So I've always been inclined to helping other people. That's been a passion of mine since I remember. And I feel like as a person and as a community health worker now, I love to educate the communities at risk, especially about the different resources so they can utilize them and they can become better in reaching their goals. So now that I work as a community health worker for Nurture KC, I feel like I can, help and educate those families and enrich their relationship between families, parents, and children, because I think ultimately that's what's going to become a better society as a whole. So it's just, I love to empower, help, educate. I'm a people's person, so I love to just help out.
You are, definitely. That describes you to a T. Yes, for sure. Marcella, can you describe what a typical day or visits with your families look like for us?
Sure. It depends on who's coming over. Usually, I mean, we work with pregnant women,
Right.
but we also work with infant caregivers.
Mm-hmm.
So typically, they come over and we spend a good 20 to 30 minutes just talking about what's going on in their lives. So I ask questions if they're feeling okay, mentally, physically. We talk about their pregnancy, and also if they need to translate any type of paperwork or fill out any paperwork for food stamps or Medicaid or anything like that, we can do that. I think the first part of the appointment is the most important because I want them to feel that I hear them, that I can do anything possible so they can feel okay. Then after that, I usually pick, if the person is pregnant, I usually pick a couple of good, interesting topics to talk about. For example, if the mother is coming and she's in the last trimester, we talk about preeclampsia. How do they feel? How does somebody feel if they have the signs and symptoms of preeclampsia? Also, gestational diabetes. Counting the cakes is a great topic for me to talk about in the last trimester. I think it's important for people and for pregnant mothers to know about those topics. So I have a long list of topics to talk about, but I don't want to make it too overwhelming for them. So I just talk about 2 or 3 at a time. So after that, I usually, feel out if I have enough time, because some people just, take more time talking about how they're feeling and what they need. But at the end of the appointment, if I have time, I usually fill out my information and my paperwork for data collection. But I feel like the most important thing is the first half of the appointment, like I said. So, because I want them to feel comfortable, and I want them to feel that they can trust me so I can help them out.
And that's why you know your participants so well, I think, is that listening component.
True.
What are some of the needs or the barriers that, come up for families and how we solve those? Can you speak a little bit to that?
Sure, yeah. So right now, I think at this moment in time, I see that a lot of people have trouble finding transportation. That's huge. Also, I've seen with the communities that I work with right now, lack of support. Like Shannon was saying, people feel alone. People feel not supported at all. Some people come alone because they're immigrants, so they travel from all over the world to be here in the United States, and they feel they have no support whatsoever. Also, I think housing at this moment is pretty hard. People are struggling to find, cheaper housing. Right now, a 1-bedroom apartment can go for $1,400. And our communities and families are struggling a lot with that. But thankfully, at Nurture KC, we provide the support. We provide the transportation. As also Shannon was saying, we provide Ubers for our families so they can come to the appointments and they can go to the doctor's appointments. And also as community health workers, we try to provide the support as much as possible. I mean, people keep coming over here, and we provide all the support that we can provide for them.
Yeah, that's great. That's really unbelievable. What about shifting to some of the success stories? Because I personally know there have been so many, so I'm sure it's hard to just pick out a few, but I think it might be important, for people that are listening to maybe know a personal story or two.
Yeah, so I have many. I've been with Nurture KC since 2018, so I have a lot of stories, but a couple that I remember right now. Elena, she's an immigrant from El Salvador, and I met her in 2018. She was 4 months pregnant, and whenever we meet our participants for the first time, we try to set up goals so they can achieve them while they're in the program. So one of her main goals was to get a driver's license, but she was just petrified because she didn't speak English very well. So I, researched and I figured out that she can take the test in Spanish. So we set up a couple of months to study. I sent her a lot of videos and information about the test. And she told me, I feel I'm ready, but I just don't want to go. I don't think I'm able to do it. So I'm like, don't worry, I'll go with you. We'll meet there, I'll help you through the process, but you're going to have to just take the test yourself. She was like, sure, I can probably do that. And she was super happy and excited that I was able to go with her. So she took the test, and sadly she failed the first time, but she didn't know that she can take it 3 times a day. So she went around and took it again and passed it. So she was super excited. She was even crying, thanking us that without our support, she wouldn't have done it. So she graduated successfully from the program in 2019, I believe. And she's back again. She's pregnant again. And, she told me the first thing I thought when I realized I was pregnant is calling you. So she's back with us again.
That's so special. And I just think demonstrates, that bond that you have. You become friends with these women as well as like an educator and supporter, which is so amazing. Are there any other stories that you want to share?
Yeah, there's many stories. But another one that just, comes into mind right now, it's Fabiola. She's another immigrant from Honduras. She came to me and she was 4 months pregnant and she was very depressed. She was in a bad situation financially. And she just, didn't want to be pregnant, but she was able to attend the Mother's Voice, actually. And she found all the support she needed through that group. And she's been amazing. She already delivered a healthy baby girl. And now she's the one of our participants that it's going to become a doula soon. So now that she saw how we help her, she wants to keep helping other people as well. And we gave her that opportunity to help other women since she's becoming a doula.
That is really amazing just to see the impact, that Nurture KC and you had on her. That's great. What about, what do you want people to know about our Healthy Start families?
Yeah, I want people to know that everybody's welcome. I mean, we're trying our best to reduce maternal and infant mortality. And, we support people. We help them through the process. We help them while they're pregnant and after they're pregnant. So, we're here to help.
That's great.
Well, and I will say for Marcella, her families stay in touch with her long after they've graduated from our program. It's such a deep bond that she develops. And it's interesting because we've never really had a marketing plan or strategy around Healthy Start. It really is word of mouth.
It is.
And that is the ringing endorsement of the program. And she never has to go out looking for families because her existing families continuously refer her.
Yeah, and it's very rewarding. The people come over, they refer other people, they become pregnant again and they try to find me. Or if they have any questions after they graduate, I tell them, just save my number. You don't have to be part of the program if you have a question that I can help out, because that's my main goal is to help others. So you can call me at any time.
Yeah, that's so great. I love that. Well, anything else that anyone wants to add before we wrap?
I think it's important to remember that any organization that works to improve birth outcomes for Black women and Black children is going to improve birth outcomes for all women and all children. And so I think it's very important for the community to know that and to realize that and to support that.
100%. Yeah. Thanks for sharing that, Shannon.
Well, I would just say we do serve 14 zip codes for Healthy Start mothers. So the only qualifications being that moms must be pregnant upon entering the program and reside in one of those 14 zip codes. And those are the zip codes in the metro with the highest rates of infant mortality. I am happy to report that for participants in our program, they defy those mortality rates. And we just want to keep building upon that. And I did want to say that Shannon has done such a phenomenal job moving this program forward. And this always sticks with me, but she has often said that she really wants to be a servant leader. And she absolutely is that. She is also bilingual. And I think that's another important aspect of this program, that we relate to these families where they are, not where we are.
Yep.
And, I think continuing to do that and the behavior that Shannon models has really gone out to all the community health workers. And that's why it works.
That's why it works. For sure. Sets the tone and is really a unique program, unlike one that I've ever seen for a nonprofit, at least here in Kansas City. I mean, it just helps so many people. I have been so impressed by it. Well, great. Thank you guys for participating in our second podcast. I would like to know if, the public or if there's families wanting to learn more about our Healthy Start program, they can check us out on the web at nurturekc.org. And then we'll be meeting again next quarter for our next podcast on Promise 1000, our newest program to Nurture KC.